the participation request form for the Fall Flex Workshop, which will be in October in Rockville, is now available. You can find that on our website. I'll put the link in the chat in just here in a second. A reminder, we have a maternal health TASC 90 next Tuesday, August 27th. Again, I'll put those details in the chat box. We're also hosting, co-hosting some office hours on September 5th with the Flex monitoring team and FORHP. A save the date for that event will come out shortly after this webinar, and I'll post the event page for that as well in the chat. We are launching the annual updates for our Flex program profiles here shortly, so keep an eye out for that correspondence from the TASC team. Just a reminder that the Flex profiles are a huge resource for other state Flex programs, and we ask that you take the time to update those annually so that we can keep the content current and they can continue to be a resource to you all at the state level. And just a reminder, as always, TASC is here to support you as you begin this new program cycle on September 1st. We're excited to see the work that you all are going to do at the state level. Whatever you need, just let us know. We're happy to help you, and we can't wait to see what you all have planned. So with that, I'm going to turn it over to Miss Laura and Miss Megan.
So I'm up first. Hi, everyone. For those of you who do not know me, my name is Laura Seifert, and I am your Flex Program Coordinator. What we're about to talk about right now is very, 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 very important. I cannot underscore how important this next few slides are that Bria Haley is going to talk about. So for anybody who might be like listening to this Zoom in the background and answering some emails right now or doing some other things, I'm going to give you about 10 seconds while I do this introduction to come back into this webinar and make sure that you're watching the next couple of slides. The way that you file your federal financial report is very important, and especially right now as we're wrapping up the program cycle. So for all the finance folks who may be on this call, I'll let you know when you're able to drop off. We'll do the finance stuff first, make sure that we get that out of the way, and then you can drop off and we'll do all the other things for all of our program folks afterwards. So again, please make sure if you're listening in the background and you're answering emails, you come back into this webinar right now. I'm going to kick it over to Bria Haley, who is our lead GMS, which stands for Grants Management Specialist on our Flex program, to talk about the federal financial report. Bria, over to you. And next slide, please. One more slide. There we go.
Thank you, Laura. Good afternoon, everyone. Thank you all for joining. As Laura said, my name is Bria Haley. I am the lead grants management specialist for the Flex program, and we're going to be going over the FFR today and a few post-award reminders. The FFR is a little bit different this year because we are at the end of the cycle. So I just want to make sure that we don't have any issues when it's time to submit the FFR, but if anything comes up, we are here. So your federal financial report, FFR. So recipients must submit an annual FFR due 90 days after the reporting period. The due date for the reporting period ending in 8/31 is due November 29th. So mark this on your calendar, put a big red highlighted sticker because we cannot miss this due date. The report must reflect cumulative reporting for the project period. The report is submitted in the Payment Management System, or PMS. And lastly, because we are in the final year of this cycle, the FFR must be marked as final. Next slide, please. Thank you. PMS permissions. This slide provides information for staff members who are responsible for preparing and certifying the FFR. We've added some resources to assist with requesting PMS access. There's a link to a training video on YouTube. And please note that the new user request can take up to 3 to 4 days to be approved. And unfortunately, your grants management specialist will not be able to assist with PMS permissions. We don't have the ability to see the information on their database. So if you need additional support with setting up your payment management accounts, please contact the PMS help desk. Next slide, please.
Hey, Bria, can I jump in and say something super quick, just because I have a feeling it might be a question? When Bria was just talking about PMS, That stands for Payment Management System. And for anybody who's new in this webinar, PMS is different than the PIMS reporting submission that we just talked about last week in Salesforce. That is entirely different than PMS. So just make sure that you have there are different people who use this. There's different permissions allowed, but they're different systems, so don't get them confused.
Thanks, Laura. Thank you. FFR workflow. Recipients will navigate through several sections of the FFR to enter financial data. The Prepare Report section has several pre-populated fields. This is the federal agency name, your grant number, organizational name, UEI, and the EIN. And then we have the basic information section. This is the FFR report frequency. You have the basis of accounting and the project period and reporting period end dates. Next slide, please. Moving on to the FFR transaction section. In the FFR transaction section, the first three fields are 10A, cash receipts, which is pre-populated based on the current drawdowns in payment management. 10B, cash disbursements, which is also pre-populated based on the disbursements last reported in payment management. And then you have 10C, which is auto-calculated, and this is the cash on hand. Next slide, please. Okay, FFR transaction section continue to lines 10D through 10H. It is very, very important that the information in this section is correct. Line 10D is the total federal funds authorized, which is pre-populated from the award document. Line 10E is a federal share of expenditures, which is entered by you, the recipient, and must be cumulative for the grant document number. Line 10F is a federal share of unliquidated obligations. And then line 10H is the unobligated balance, or UOB. This is pre-populated. Next slide, please. At this time, we will discuss the difference between unliquidated obligations and the unobligated balance. The unliquidated obligations are the costs that have been incurred but not yet paid. So if you have invoices that you have not paid or funds that you have incurred that you have not drawn down yet, those are your unliquidated obligations. So as we talked about earlier, this is a final FFR, and you may not report unliquidated obligations on the final FFR. You must liquidate all of your expenses before submitting your final FFR. The FFR due date is November 29th. So all expenses must be paid out by then. Okay, so that's really, really important because in the past, you were allowed to enter unliquidated obligations. But for this FFR, because it is a final, you cannot enter unliquidated obligations. So just keep that in mind. Okay, so moving on to the unobligated balance. So this is a portion of funds that has not been obligated by the recipient. On the FFR, this is pre-populated based on the funds authorized minus the reported expenditures. Here we have an example on the screen. If you have an authorized amount of $100,000 and you have expenditures of $50,000, then your unobligated balance would be $50,000. Those are the funds that have not been obligated, not spent. So say you have an unobligated balance of $50,000. Now, how can we use that? The unobligated balance can be used as carryover in the next budget period, or it will be used to offset the amount of new funds awarded in the following budget year. Next slide, please. Thank you. So if you have an unobligated balance, you may request to use those funds as carryover in the next budget period. You must note your intent to carry over the funds in the FFR remarks section of the FFR. You must request prior approval in HRSA EHBs to use the UOB as carryover within 30 days of your FFR submission. I'm going to say that one more time. Once your FFR is submitted, you have 30 days to request carryover. Please note, if you do not request prior approval to use the UOB as carryover, you are not authorized to spend those funds. If your carryover request is approved, you will receive a revised notice of award that reflects the authorization to use those funds as carryover. Please do not use the carryover funds until you have received the approving notice of award. Okay, so now we will discuss offsets. If the unobligated balance is not used as carryover, then it will be used as offset in the following budget period. An offset does not change the current budget period authorized amount, but it does reduce the amount of new fiscal year funds provided to support the total authorized award amount. Here's an example. Let's say the authorized amount for FY24 is $100,000. And there was a UOB of $20,000 from FY22 that was not used as carryover. HRSA will provide $80,000 of new FY24 funds, and then we will use the $20,000 UOB from FY22 as offset. So we're going to combine the $80,000 FY24 funds and then the $20,000 FY22 funds to provide the total authorized award amount of $100,000. So again, your award amount, your normal award amount will not change. Now, I know this is a lot of information and sometimes it can be confusing, but if you have any questions about offsets, if you have offsets on your award, please reach out to your grants management specialist and we'll be able to walk you through your award. If you have carryover and offset funds, that will be reflected on your notice of award. So please review the terms and conditions section. Next slide, please.
Bria, there is a question in the chat. Is carryover allowed from this final budget period into the next project period? Oh, and it looks like Laura says yes, carryover is allowed. Okay.
Yeah. Okay, thank you. FFR remarks. This is the FFR remarks section. So you can use this section to notify HRSA of any changes from prior year expenditures or anything that we might know in this section. And well, remember, if you intend to request carryover, you must note that here so that when we're reviewing your FFR, we know that you intend to request carryover. Next slide, please. Okay, post-award. Now we will discuss some post-award reminders, and we're starting with the prior approval request. This is when a recipient needs to change certain aspects of the approved application of the award after it is issued. The prior approval request is submitted in EHBs in the prior approval module. Please note that it may take up to 30 days to receive a response from HRSA. Recipients may not move forward until HRSA approval is received, and you'll be notified via a revised notice of award or an EHB email notification. Next slide, please. Here are some common types of prior approval requests. We have the personnel change, carryover, rebudgeting, change in scope, extension of project period, and project period with or without funds, and other drawdown, transfer, relinquishments, all of those things. Next slide, please. Thank you. Okay, so before I close out, I just wanted to circle back to unliquidated and unobligated. I just wanted to be very clear that the unliquidated funds are very different than the unobligated funds. And we have an example here. If you have a contract, $20,000, and the work was completed in the program year, but the contract has not been paid out yet, those are unliquidated funds or liquidated obligations. And then unobligated, say your contract was estimated at 20,000, but then the final cost came to 15,000. Then your unobligated balance would be 5,000. That is the money that has not been spent. Okay, and as mentioned before, if you do not request carryover for an unobligated balance, you do not have approval to spend those funds. You cannot use carryover funds to pay back any late expenses. And if you're reporting something unobligated and then pay out more expenses, you will be overspending your award. And lastly, you cannot report unliquidated expenses on this final FFR. Everything must be paid out by November 29th, 2024. Next slide. Thank you. So if you have any questions or any issues with your FFR, you can submit a submission in the PMS portal. Anything about your award, we'll be able to help you. You can email me or your grants management specialist. Our contacts are on your notice of award on the first page to the bottom. I think it's to the left of the screen. And that's all. I'm gonna pass it back to you, Laura.
Thanks. But before you go, Amal, can you go back one slide? I'm just gonna like cosign, second, repeat what is on this slide. Because for everybody who's listening who may be a finance person, or for any of our program folks, if your finance person could not be on this call, this is a really important slide to keep in mind. The most common question that I think we get, and the most common error that we have seen, is mixing up unliquidated expenses and unobligated expenses. So in this scenario, when everyone, as the question was asked in the chat, is carryover allowed on a final budget period? Yes, carryover is allowed. In this example, you could request carryover for $5,000 for the unobligated balance. You cannot request carryover for $20,000 to pay out the contract that has not been paid yet. So I want to make sure that all the finance folks are very, very clear on this, because since this is a final year, all the expenses must be paid by November 29th. PMS will lock your funds. So if there are any other questions before Bria jumps off, or before we go to the next slide, are there questions? Come off mute, ask your questions, type them in the chat. No? Okay. Well, let us know if you have any questions after, in that case, or as they come up. Can we go to the next couple slides then, Amal? Okay, so super quick, we'll talk about carryover. And then after we talk about this, all the finance folks can drop off the call. So as Bria mentioned, this is a repeat again. Your FFRs are due November 29th. You are able to carry over funds, but those funds, if you do a carryover, need to be spent by August 31st of next year, 2025. When you're talking about a carryover, please, please, please reach out to the project officer and discuss what your plan is, so we can help you figure out what is allowed, what's not, how can you spend your carryover money. And as Bria mentioned, you need to use the FFR remarks section to express your intent to carry over funds. And it is very simple. You can type in one sentence that just says, we intend to submit a carryover request of X dollars. Problem solved. Next slide. These are the documents that you'll need to submit to do a carryover request. And we have templates that we send out every year. I'll send those out very shortly. I had hoped to get them already posted on the TASC website to drop links for you, and I have not done that yet. So we'll send them out and get them posted for you, but you'll need to go into, and yes, we will send out a copy of all of these slides and the recording when this is ready. So to submit the prior approval, you'll need to do a carryover request in EHB, and you'll need a cover letter that explains the reason for the unobligated balance and what the plan is to spend down the funds in the current budget period. And as a note, with carryover funding, you cannot use carryover funds for new activities. You can either finish a project that was delayed from last year, or you can expand on a current project you're working on now, but you cannot use them for new activities. In addition to the cover letter, you'll need a budget justification only for the carryover amount. And we do need a cost breakdown. If you're going to have a $20,000 carryover into contracts, we need to know the cost breakdown of how that will be spent. So is it by a certain number of deliverables? Are you doing 4 webinars? Are you doing 2 meetings? We need to know what the breakdown is that you are expecting to achieve. There's also a form for the SF424A, and that is an automatic, it's an electronic form within EHB. So there's a Link right there if you need it, how to request a prior approval. And as Bria mentioned before, the hard final deadline for this is December 29th of 2024. I know that this is right in between the holidays. It's right in between Christmas and New Year's. And I know people are traveling. That is a hard deadline. We cannot grant extensions for carryover requests. So please, please, please talk to your project officers now and start planning what you maybe want to do and working on some of those documents, and we can help you get those ready so that you do not miss that deadline. Next slide. Some helpful tips. As I mentioned, talk to your project officer early. The thing on a timeline with carryover requests, this is the second most common question that we get. And also shout out to Bria for sharing this information with me. HRSA has 30 days from the date of your submission of your carryover request to issue a decision. However, if either your project officer or your GMS needs to request changes, if the language isn't right, if the math doesn't add up, you missed a document, whatever it is, that 30-day timeline will start over. And you cannot spend that funding until you get your notice of award. So I put in a few examples down here on like, if you get your carryover request in early, if you do it before the deadline, you can get it, get it to us in November. You could have approval by early December. You can go ahead and start spending those funds. But as you can see, in any of these cases where there's changes that might need to happen, if you look at Program C, for example, they may turn in their carryover request before the deadline, mid-December, but we ask for changes and then it takes through the holidays to get that information sent back to HRSA. That means that you may not have that notice of award and that approval to spend your money until the end of January, which could delay some of the work that you're trying to do. So just keeping this in mind, HRSA has 30 days to issue a decision and that timeline could start over. Next slide. Okay, so for that case, we're gonna let the finance folks drop off. You are welcome to.
Laura, we do have one question.
Yes.
What if we want to use carryover funds from our traditional flex budget, but we have REH carve-out funds left over that we won't be requesting carryover for? Is there a special process for this type of request?
So Wanda, you're saying you have REH funding left over and you're not requesting a carryover for it. That's right. Which is, I mean, sorry, you can't actually, because you can't request a carryover twice.
Right. We had carryover funds this past year that our contractor came in with a lower bid than what we anticipated with the carryover request. So we used a portion of that, but we will have some left over. And so I didn't know does that make a difference in our FFR? Is there some special process for that? I know it's probably all lumped together for the FFR maybe, but I guess I was just asking in case that kind of muddied the waters.
I would say what you need to do is, if the REH amount that's left over is like $5,000, just leave that out. And when you put in your remarks this time that says, I intend to do a carryover request of blah, blah, blah dollars, just don't include that amount.
Got it. Thank you.
Yeah.
Laura,
Yes.
so so how is it differentiated? You said you can't request a carryover for a carrier. So how is that just based off of what we explain in the prior approval request in the cover letter that shows you if we're requesting a carryover for a carryover, or how is that determined?
Yeah, it's how you explain it. But like if you came into a document and said, I have money from FY21 that I carried over into FY22, I need to do it again, like that, you can't request a carryover of a carryover.
Okay, so it's possible to have a carryover request that's larger than last year, so long as it's not those same carryover dollars, if that makes
Right.
sense.
Your carryover amount can vary year to year. It could go up, it could go down. The important thing to know is that you cannot request a carryover of more than what is reported as unobligated in your FFR. You can request a carryover less, but you cannot request more.
Got it. Okay, thank you.
Any other questions on carryover FFRs before the finance folks drop off? Okay, hearing none. Bria, you're welcome to stay for the rest of the webinar if you want to. Otherwise, I know how swamped you are, so you can drop off as well. But a major, major thank you to Bria for always being here every year and helping us out and explaining this.
Yes, no problem. I'm glad to be here and thank you for having me. I'm going to listen for a little bit and then I have to drop off at 4, but I'll be in the background.
Great. All right, so this is going to be super quick. The last little bits of reporting that we have to do, and then we'll start talking about the next program year. So next slide, we're going to talk about your end of year report. For anyone who has been around for a couple of years, this end of year report has the exact same structure as it has had always. For anyone who's new, this is just a sum up here of what you did in this past year, right? So what we'll need you to do is go in and you should have a submission in EHB. There will be a task for you and you can upload it right in there. And we'll need an updated work plan. So there's a column in your work plan that says like actual outputs. We'll need that. We'll need to know what outcomes you achieved. I think on the old work plan, it's out on the right side, on the very right column. So a completed work plan for the past year, telling us everything that happened. If something did not happen, if there was a delay, if a project did not happen, we'll need you to just tell us why, tell us what happened. And then we need a narrative report also attached where we talk about one significant accomplishment per program area that you are working in. I want to repeat that is per program area. That is not an accomplishment like per activity category. Okay. So just one in quality, one in finance, one in population health, one in EMS. So tell us how you did, what was the activity? How did you implement it? What were you expecting to happen? What did happen? How did that impact your hospitals? What changes did you notice? Did you have any lessons learned? What were your best practices? And would you recommend this for other Flex programs? Next slide. For anyone who had an EMS supplement report that is ending, your project period is ending August 30th, 2024. There is a final report due November 30th. A brief overview of your project. Who were your key partner organizations? What lessons did you learn? What challenges did you have? What are your sustainability efforts? And then also, again, an updated and completed work plan with the outcome measures. Talia, anything you want to add?
No, I think, those are the highlights of it. I would just say to any of the states with the EMS supplements that if you have any questions, once you receive the template that's got this information on it and a little bit more explanation, just let me know. I'm always happy to answer anything if you need it.
Perfect. Next slide. Alrighty, so for the next half hour, we're going to talk about the next project cycle. I am going to try to do the first part of this pretty quick because Megan has a bunch of information for us on the CAH Quality Assessment. But the first thing I'm going to say here, congratulations. We all finished out the last 5 years, the last project cycle. Give yourselves a massive round of applause. Big old congratulations. You wrote your applications. You did it. You've all got your funding. Great news. So now where are we going? What are we doing in this next program cycle? These are all things that you have heard over and over again, but we're going to repeat them just because I know that, we all want to talk about our priorities and what is the big goal of FORHP and of our programs in particular. So this is a little bit of a repeat of what you all heard at the reverse site visit this year. So our priorities in the hospital state division, which is where your flex grants live, but also your SHIP and SOAR and all those other things, we're really tracking on our hospital issues. We're working on identifying workforce challenges and what successes those may be. We also know that identifying access to capital is a huge priority for all of us, for you all included. So there is some work. I don't have a whole lot of details on that because NOSOR is the one who's in charge of that. But if you have any questions on any of that, you can reach out to NOSOR directly. We also are going to be talking about telling the story of our programs. That is something you heard us talk about all through the reverse site visit. How are we evaluating our programs so that we can actually tell the story and tell the impact of what we're doing to Congress so that they know just how important this funding is, right? And as usual, we're going to continue our flexibility, our adaptability, and being collaborative with you all because these are cooperative agreements. And we know that flexibility and adaptability, the ability to change what you're doing if you need to, if something else comes up, a more urgent need comes up, we're going to continue doing that as we have always done. Next slide, please. So for our flex cycle, I'm gonna start with one thing that I saw on the last slide. We're going to continue it on this slide because it's also a priority for both. It's this excellence in grants management. So I know that is not the fun part of working in rural health. It's not the fun part of Flex is being a grant manager, right? However, excellence in grant management and telling the story of HSD programs really, really are super connected. They go hand in hand. We can't tell the story of what's going on. And there's so much interest within HRSA and the administration as a whole and work in supporting rural hospitals that we need to be able to share quantifiable outcomes from the work that you're doing. But that is also like helping you manage the grants efficiently. And that might be helping to like giving you TA and answering questions in your contracts and making sure that the due dates are all met and all of those things, writing those reports that we need because we use all of those reports to tell the story to Congress. So I know there's a lot, and I know there's a lot of paperwork that goes with this, and it's not the fun part of the Flex program, but it is something that we are passionate about. And that's one of our priorities for this year. So we're going to keep talking about it. Otherwise, I'll talk very, very briefly on those other three things in the next couple of slides. Next slide, please. You all saw this in the NOFO, but I'll go ahead and highlight this. The only change in our Flex program areas and really the goals of our Flex program is that we removed innovative model development as a program area on its own. What we did was we broke it down into these 5 areas, but we are still encouraging you to work in innovative models of care and work in new and innovative projects. You can just do them within all of the other program areas. So please keep doing it. Just put it in a different place. We still want to see all of those things. This was just for streamlining purposes and to make things a little bit easier. Next slide. Okay, MBQuip 2025. I'm not going to talk a whole lot about this because we've already talked about this and there are so many links and resources. If you want them, please call me. I can give them to you. I'm just reminding you of where we are in this timeline, right? So we're right here about to start September 2024. We are still in the preparation phase with these new measures, right? We're still getting CAHs up to date, making sure they know what the new MBQuip measures are. What are the core measures? How are we reporting them? If there are questions, if there's feedback, things like that from the hospitals that you want to share with FORHP, please do that. We're making sure that we're getting them ready. So that way by September of 2025, the next year, that is when you all will start tracking any of those hospitals who are not reporting. Okay, there are still lots of resources and tools to come. There are still tracking tools to come and templates and all the things, but I'm just reminding everybody, this is where we sit in the timeline. Next slide. Okay, evaluation. You're never going to hear me stop talking about evaluation because this is just so important. Why is it important? We need to tell the story of the work that you're doing. This is critical so you can track the progress of your work, share what the impact is, and really when you need to make changes. So it's all boiling down to 3 important questions. What do you want to change? What did you do to change it? And what actually changed? That is as simple as the questions need to be that we can take these stories up to Congress, right? So next slide. We're doing all of this and moving towards outcomes and impact. These are just all of the things that we've been doing so far, right? We put together a glossary of evaluation terms. It's linked here. It's in your NOFO. We're focusing on the difference in our language so we can focus on outcome measurement. We're moving between explaining the difference between activities and projects and really honing in on what can have an outcome. We made changes to the work plan templates. We're doing all kinds of TA. There's evaluation webinars that were done. They're all on the TASC website. We're all working together to do this. And we're also working to improve PIMS. You heard us all say this at the reverse site visit. It is in progress. So if you have ideas, if you have suggestions, send me an email. We have not built a new PIM system yet. We are working on it. So we still have time for suggestions if you want to send them over. Next slide. Okay, that's it for me. Hopefully I didn't take too much time, Megan. I'm kicking it over to you.
Perfect. No problem. We have lots of time. Thank you, Laura. And hi, everyone. I am Megan. I am from the Flex monitoring team, and today we're going to kick off talking about the 2024 CAH Quality Inventory and Assessment, or just assessment. And so we can go to the next slide. So just as background, as a reminder for most of you, or to let the folks know who are new, with funding and support from the Federal Office of Rural Health Policy, the Flex monitoring team, we've been working with partners on this project since 2022, and together we've developed a standardized mechanism to gather information to assess CAH quality improvement infrastructure and to better understand CAH measurement and quality activities across a bunch of different service lines. And so this is the 2nd year of the assessment, and we're really excited for year 2. We can go to the next slide. So as far as year one results, we'll recap what happened last year. We had over 1,200 CAHs respond to the assessment. So that's 89% of all CAHs nationally. And we were really excited about this high level of participation. And honestly, you know, we know that this was so successful because of all of your state flex programs and the work you all put in to encourage your CAHs to respond and help to get their questions answered. And so we really appreciated that. And because of that success of the first year, you know, your state flex programs now have a wealth of knowledge for most of your critical access hospitals. And a lot of states have all of their critical access hospitals information. And so that information is hopefully able to support your cause in a better way. And so if you or anyone on your team has questions about the assessment data, please reach out to us. We're happy to help you work through it, think about ideas of how to use it, or just kind of get at what you need. And also here is a link to the 2023 national report as well. Go to the next slide. So as far as assessment components, very briefly, there are three main components of the assessment. The first is CAH characteristics. This includes items like hospital system membership, average daily census, and emergency department volume, electronic health record vendors, and things like that. The second section is the CAH quality infrastructure measure. So that's one of those new MBQIP 2025 measures. The measure is collected through the assessment. And so by submitting the assessment, that is the way in which hospitals report this measure. And then the last section is an inventory of services and service lines and related quality measures. I'll get to that part in a second. We're not going to get into more detail about any of these components today, but if you are a new State Flex program or you're a returning State Flex program looking for more detail about the assessment, I encourage you to go to this link on this slide and listen to a full recording that goes through the assessment in a lot more detail. And that's also on our assessment resource page, which we'll link for you all later. And so that's not all, this recording is not only for State Flex programs, it's actually also really tailored for critical access hospitals. And so that's something you can share with them as well. On the next slide, instead of going through kind of those details of the assessment, I'm going to talk about some of the changes and some of the additions to the assessment. And so first, I want to note that the inventory of quality measures section that was included in year one, so that was a section that asked about measures that cause our tracking and reporting. That section is not included this year. In the future, for year three, for next year, we plan to change that section a little bit and kind of streamline it. But that section will only be asked every other year going forward. And so that is not included this year. We've also updated instructions to provide more detail to certain sections where CAHs and State Flex programs provided feedback to us last year. And then we've also added a few questions, including a question on volume for swing bed admissions, as well as swing bed average length of stay. We ask about HCAHPS vendor and accrediting agency. And then we've added a couple of new service lines, medication assisted treatment, outpatient pharmacy, dialysis, assisted living, and urgent care. And finally, I want to note there's a new resource this year. So we have two versions of our questions and instructions document. So last year we had this instructions document that folks could go through and see the questions, all the text for the questions, as well as a description of how to respond to those. Last year we just had a PDF of that document, and we got several requests from hospitals to create a version that's fillable for them or editable for collecting the data as they go through. So this year we've also created a Word document version so that CAHs can use that to collect their data. The next slide. Here, like I said, we have a lot of resources for the assessment. These are all available. They're all live right now on our Flex Monitoring Team website. There are two new pages of resources for critical access hospitals and for State Flex programs. So the first page, that link for assessment resources, this is really tailored for hospitals. And so we'd encourage you to share this whole page with them. It has some information that'll be useful to all of you as well. It has the questions on there. It has a CAH fact sheet that you can share with folks. Like I mentioned, the PDF and the Word document of the questions and instructions, the recording that I mentioned earlier, as well as the national report from year one. So feel free to share that whole page with all those resources with your hospitals. And then the second page has resources tailored for state flex programs. So that has a fact sheet for state flex programs. It has an email template for state flex programs to use in sending that to their hospitals. And then it also has instructions for using the year one assessment data that you all already have. One big caveat for that email template is that template is intended for you to use on this opening day of the assessment, which is September 16th. So please do not use that now because they'll get that the link for the assessment is in there, but it's not live. And so in any communications, we strongly encourage you to start reaching out to folks, but don't use that email template until you're sending them the, hey, the assessment's open and it's live. So those are all available there. And then the last one mentioned on this page is the CAH Quality Infrastructure Measure Specifications. Hopefully you've heard about that before today, but those are just the specifications for the CAH Quality Infrastructure Measure, and those are on our website as well. Can go to the next slide. So thinking about preparing for the assessment, we'd really encourage you to start reaching out to your hospitals as soon as possible and let them know that the assessment's coming. Share the resources with them. If they want, they can start collecting the answers to the questions. They have all of those. You can share them anytime, and we really want you to encourage them, for those who submitted the assessment last year, to find their responses from the assessment last year. So when folks completed the assessment in year one, the quality contact that was listed in there, they provided an email address, and that person received a confirmation email, and that confirmation of their submission, that email contained a PDF with all of their responses. And so here are some instructions that you can share with them for how to find that. They can search for the monitoring at flexmonitoring.org, which is where the email came from, or the subject line said, your response has been received. And so those are just some things that we'd encourage you to reach out to when you're reaching out to them, to encourage them to find their responses from last year. The next slide. Like I said, the start date for the assessment is September 16th. And that will be open until November 22nd, which is the Friday before the week of Thanksgiving. That link in the CAH email will go live on the 16th and not before then. We'd encourage you to start reaching out to them now, but if not on the 16th, right when you can send that out by the 30th, to email the CAHs with a link to the assessment and all these supporting materials. And then they should be completing this by the 22nd. Later in September, we'll also be sending out a tracking document so that you can track your CAH's completion of the assessment in real time. This will be the same document as last year, but that automatically updates as soon as someone completes an assessment. And so you can check that at your leisure to see who's completed the assessment from your state. And also, as I think Caroline mentioned earlier, on September 5th in the afternoon, we'll be hosting an office hours with FORHP for the assessment. Folks, there's not going to be any content covered there, but we'd encourage you, if you're a new State Flex program, maybe watch the recording of the complete assessment information before attending that, and then bring any questions you have to the office hours. We'll be there to answer any questions that you might have. And the next slide. Just some reminders when you're reaching out to your hospitals. We encourage them to collect the data for the assessment, in any way they want. They have that Word document that they wanted now. Gather those answers. They're going to need to work with multiple people on their team, more than likely, to get some of the answers to the questions. And so they should collect all of the data first and then go on to the submission platform to submit their answers. It's estimated that it'll take about 60 minutes to both gather and submit the data. It may take a little bit less time because they don't have that quality measures section this year. And then again, the hospitals will receive a confirmation email after they submit the assessment, and that will also have all of their answers. And so they should be encouraged to keep those again for the following year. And one more slide, I think. So we really just want to reiterate how important the assessment is and how much we are grateful for all of your help and getting it out there to your hospitals. So we'd really encourage you to start preparing your hospitals now, send them those resources. If they have any questions, they can reach out to us, you all can reach out to us. And that's really all that we have. And so I think I'm happy to answer any questions about this, or I'm sure Laura's happy to answer any questions more generally, but everything
There's
else.
a couple of questions in the chat.
Yes.
What if the person from last year is gone And to follow up on that, that with the amount of turnover, I don't expect most of the hospitals to still have that confirmation email. So is there any way the confirmation can go to both that contact and the state flex program?
So
Jennifer's
there's,
question, and Jennifer had the first question. I did see her come on camera. I don't know if she wants to add anything to it.
no problem. Yeah, so if there's someone who cannot find that information, we really want folks to be able to do this on their own. We don't have a way set up for them to send it to the state flex programs. That would be 90 emails to Ava, so there's some technical pieces in there. This year it will go to 2 people or up to 2 people. It'll go to the person submitting the assessment and their quality contact. So it'll be going to those if they're different people submitting the assessment, they can do that. We would recommend that you all work with them to try to save that information as the turnover, we know that may be an issue. But if a hospital tries and is unable to locate that information, they can reach out to us and we can help them out with that. And so we really want them to be able to become sustainable. They're encouraged to do this with NHSN and other things that they're submitting. But if they have a problem and can't do that, they can reach out.
Jennifer, I see you came off mute.
Yeah.
Did you have something you want to add? And then Danielle can be next.
Yeah, so we did get summary reports. So I'm assuming technically we have their answers to this information, correct? Because we got basically everybody's answers.
So you have most of them. For certain things, you don't have the detailed level answers of things.
Okay.
And so in the data that you all have most of the answers. But again, it's not going to be in a format that's easy for them. The PDFs they have go by question, and it looks like the screens they submitted, which is really similar to this year's. So you have most of the information, not all of the information.
So just to give you some perspective, we have 82 critical access hospitals and at least 30 of them have brand new quality managers since this last time they filled this out.
Yeah, and honestly, last year they all filled it out success. I think there's some benefit to not necessarily it's a good reference point, but you would hope that someone wouldn't just take the answers from last year and put them to this year. And so that's why we try to give as much time as possible for folks to do this. And I think some folks had talked about in kind of orientation calls to go through and bring the information you have or ask them to pull it out and do things and work with them. So we get that there's going to be turnover, but there's turnover for other measures too. And so I think we're trying to just make it as feasible as possible for folks. But I think we can continue to think about ways it's not really possible based on how the survey platform is developed to send it to specific state flex programs for each of the different responses. But we can continue to think about ways if there are ways to do this. In the future, you will have all of the information once the MBQIP reports are updated at the end of this year. You will have everything that they submit. But again, it's not going to be in a great format. It's in spreadsheets that you have and not an individual hospital. And so for us to create 12 or 1,300 documents is also a big process too.
So I'm wondering, I'm just thinking out loud here. I mean, really thinking out loud. Is there a way that we could maybe take our spreadsheets and create some kind of mail merge form? So we would be able to create individual reports ourselves.
It's a lot of information. And I think a lot goes into it. We spent a lot of time doing it just for the CAH quality infrastructure component. And so at this point, that isn't something that we have planned for the capacity to do. But I think we can think about, if there are ways to do that, if there are ways to kind of collect the information in a way that's easy to transfer to you all, if we can get it exported on our end in a way that it's, right now, the way that we get it exported is thousands of cells, and then we take that and make the spreadsheets. And so I think we can continue to think about it, but it's a lot of data.
But I think you'd asked Jen if you could do it yourself, right?
Right. Yes.
I mean, in theory, you can do whatever you want with that spreadsheet.
Yeah. Okay. I just, and I understand the workload on your side, but I also know our hospitals and, for the other measures, they can look at historical responses. We can give them, prior MBQIP data reports so they can see.
Right, and they will have MBQIP data reports for the CAH quality infrastructure component. Those will be in the MBQIP reports by the end of the calendar year. So they will have that piece, and that's the bulk of the data in the assessment is really with the measure. So they will have all of that, and that'll be in report. So it's coming. It's not quite absolutely everything they fill out in the assessment.
Danielle, you have your hand up, and then I know Lynette also has a question after Danielle.
Yeah, I guess, it doesn't make sense why it can't go to like myself and the hospital. And, I get, yes, it's a high workload, but you created this workload. Um, but is there a way to, and I'm sure that it's already created this, if this is going to be a continuation of this survey, that just like how this year it's going to go to two people, the quality person and the person filling it out, is there a way to have a box that says like your flex coordinator or flex programs contact info or something like that? And so when we email to be like, hey, do this survey for this question, this is the info you'll put in there. And if they forget, oh well, but at least the majority of my hospitals would probably remember to be like, oh, Danielle said put her info here. And that's just creating kind of a new page. And I only just kind of what Jennifer said, I have all the MBQuip reports from even before my time. And I have had folks ask for them, I just keep them in a I start rolling up those PDFs. But so just to have them, I don't know, I will never have a hospital ask me for them, but if it's something you think that they should have when they're continuing to fill these out, it would be better if that responsible burden was on our flex program and not them. So that was just kind of to the actual platform, if there was a way to have that there. So maybe 80% of my hospitals will remember to put my information in there and I'll have those copies.
Yeah, I think we can, so we can't do it automated, but we can look at, we can add an empty field that's optional for them to include your contact information, and then it can get sent to you. I think that puts more burden on them. And the connection of who's my state flex coordinator? Well, is it Danielle, or who's actually the state flex coordinator? Right now, often when we use state flex coordinators, we link them to the TASC site, which isn't necessarily the best contact person. And if it's a contractor versus a state flex program, so there's a lot of complexity to it, I think. We can add a blank field and have you all say, when you get to this question, but I think for what we'd put in the instructions and things like that, kind of getting at all the states operate differently and trying to get that one right person for each of the 45 states. It may really work well for states that have close connections with their hospitals and they all know you. But in some of the different states or states where there is turnover in state flex programs, I think it gets a little more complicated.
And so that live document, I do remember it last year. I'm pretty sure Lindy was like, did you look at the spreadsheet today? Not that she was sending the survey out, but it was almost like a game. Is there any way in that spreadsheet to populate any other information except for the state? Would there be a way I see, or not state, the hospital? Is there any way instead of it just saying like Summit Pacific, it could also say the person's name that filled it out. So then I can reach out to them and say, hey, you should have received this confirmation email. Can you please forward that to me so I can have it for our files? I just don't know if that's something with that live document that you can populate something like that.
Yeah, the only question there is kind of the privacy issue. So that's very public. So any state can look at any state's tab, just based on how it functions. And so we don't put any data from the assessment in there because we haven't told them that we'll be sharing that with all the state flex programs or anyone that gets this link. And so that would be the concern there. Eventually you will receive the information. When you receive the data, you'll see who completed it, but you won't get it at the time. And so I don't think we'd be able to do that just because we don't want to be putting everyone's emails out there.
We can obviously just reach out to who we have as a quality person at that hospital, but sometimes it takes them when they have, a few of ours have way more quality people than anybody else, and trying to hunt down who's the one who completed it sometimes takes a bit. So, okay, those are my only questions.
Lynette?
Hi, everyone. So I have two questions, and actually Jennifer answered one of my questions, but Megan, is it possible that you could go back to the previous slide?
Yes, Caroline, thank you. This one or
okay, the one that has all the resources on it.
Oh, sure, that's a couple. Let's see here.
Okay, sorry. Oh, yeah, you've passed it. Okay, so I had a chance to review these resources earlier today, and they're phenomenal. I really especially like the CAH email template. I think that you all have created all these resources that are going to make our jobs easier. And what I wanted to know is, when I send out my CAH email to each individually critical access hospital, am I allowed to include the last year's CAH assessment that you sent out to everybody for how Pennsylvania did in the CAH assessment, what you found out about? Are we allowed to do that so that we can kind of encourage them and say, look, as a result of you doing the pre-assessment last year, here's all the wonderful information that we have obtained from it.
Yeah, are you talking about the state PDF report?
Yes, yes.
Yes, absolutely. Feel free to
Yes.
send that with it. Anything that you think is helpful. And again, that's just a template that we tried to be overly inclusive in the email template. Feel free to adjust it as you all see fit. We just wanted to get something out there with, I think, what we saw as the most essential information, but feel free to tailor that to your hospital specifically. And absolutely, that state PDF report, each of you have a different, your individual PDF report. Feel free to include that too, absolutely.
Okay, and then my next suggestion was, just bouncing off of what Jennifer was saying and what the previous person was saying as well. I think reminding the critical access hospitals that they can use their most recent MB-QIP reports, like their HCAPs, their EDTC, their inpatient, their outpatient, because those reports are really great because it shows how they did the previous quarter. Do you know what I mean? They can use that as a resource for them.
Yes. Are you talking about for the assessment or just generally?
Both. I mean, I think it would help them with the assessment.
Yeah, I think so. And I think whatever resources you all think are most helpful, feel free to kind of mention those or add those in as folks.
And I just want to say I especially enjoyed reading all these resources because these are tools for our toolkit. This is going to help us in our cause to complete the assessment. And I'm assuming you are going to have, you said, another spreadsheet, saying who completed it, who didn't, so that we can remind them, give them a friendly reminder that they didn't complete it yet.
Just a little bit later in September after the assessment's live. So we will
Okay, that's all. I'm done. Thank you.
We've got 1 minute left. Are there any other questions? I can always stay on for a minute or two. Oh, this is just a reminder of who has what state on your for your project officers. And I put Lorraine in the blue box here because in reality, since she works with quality, she's going to work with everybody. And the next slide is just all of our PO contact information if anybody needs it. Anything else? I can stay on for a few more minutes if we need to. Or everybody can send us emails, whatever we need.
Come to the office hours.
Oh yeah, the office hours. Sorry. We'll tell you, we need to tell you the office hours that Caroline highlighted at the beginning of this call are specifically for the CAH assessment. On September 5th, Megan will be available. I'll be there, but I'm not the person who has all the answers on the CAH assessment. And this is genuinely for any questions you may have. So that calendar invite will go out shortly. And these slides, this recording will all go out along with all the other links to templates and things that we need to give you. So stay tuned for all that.